Welcome to this interview today. My name is Anton Barnett-Harris, and I am the Chief Executive Officer of the Australian Physiotherapy Council. I'm delighted today to have Fiona McKinnon, the Chief Allied Health Officer at St. Vincent's Hospital, who is also the General Manager of Allied Health and Pharmacy Services at St. Vincent's here in Melbourne in Victoria. Fiona, just lovely to have you. Thank you so much for your time. We understand how busy you are, especially in these times, but we're just so grateful that we can have an insight into the role you play in our community and just the incredible role that the hospital is playing in this pandemic time. So thank you for your time with us today.
Oh, many thanks, Anton. It's such a delight to be here. We're really pleased to have the opportunity and to really acknowledge World Physiotherapy Day. It's my pleasure to be here with you today.
Fiona, so obviously the hospital's facing very extreme times at the moment with the whole COVID-19 pandemic. So what have you observed in your hospital as your staff have responded to the COVID-19 pandemic?
It has been a really interesting time, Anton, a really quite confronting time in many ways, I think, as well, and a time like none that we've known previously. So where we don't have a manual or a book to read to say this is what you do. And it's been, to me, absolutely amazing the way that our allied health and pharmacy staff have really responded in this amazing time, this amazing pandemic. Absolutely outstanding. So I think as clinicians, as managers, and as leaders, they've just really responded to ensure that we've got a really excellent service for our patients, that it's compassionate, that we're caring for patients and their families, because that's been really, really difficult as well, and that we're providing care in a safe environment and a safe environment for staff as well. And I see across the organisation, a really collaborative, innovative, really strong approach where people are really prepared to just embrace what's going on, try to be as strategic as we possibly can, plan ahead, look at the workforce that we might need and how we can support that workforce, but also be very responsive in managing the day-to-day. It's been a really evolving, ever-changing sort of situation, and we just have to be prepared to change. And our common way of putting things at the moment is that it's a plan until that plan changes. So we've just had to be flexible, agile, be ready to focus on infection control, getting everybody organised in their protective personal equipment, the PPE, making sure that they're well trained in that, being ready for COVID testing of staff and of patients, people working across teams. So we're really working that through as an organisation. We've had fabulous leadership from our CEO and our executive team, very supportive, very focused on solving problems. And we've worked very closely within the wider sector and across the Department of Health and Human Services. So lots of things on the go and consistently underpinned by strong communication, clear messages, whether they be written messages, whether we're communicating with staff in virtual meetings, or we're making sure that we've got a forum that's happening. So those clear messages, agreed messages, written information, so making sure that our staff feel well prepared, feel safe and feel confident about managing what we've never managed before, really.
Yeah.
So it's been an interesting time.
Fiona, maybe can you share with us, especially for those who wouldn't know, what role physios are actually playing in the whole treating and the rehab around COVID-19 patients?
Yes, look, it's been a very interesting time, I think, around that. And our physios have been very adaptable, very agile, and very committed to looking at different ways of working. And allied health staff and physios in particular are really across the whole spectrum of care, from emergency department management, working in the intensive care unit, on the general wards, on our COVID wards, in rehabilitation, in the community settings, in aged care. So we've got a huge spread and responsibility there. We've done lots of planning and development of our workforce, particularly in wave one, and that stood us in really good stead because we've recently had to clearly escalate much more than we had thought we would. What we found is that the demand for intensive care has been less than we had predicted, but a huge demand for COVID care, people with positive COVID results, and also those patients who've got suspected COVID tests. And we've also had many people coming through from aged care, from the aged care facilities. That's been a really pivotal part for us here. So our staff are really looking at providing very good management of respiratory conditions, of our usual musculoskeletal and neurological conditions, but perhaps just thinking about the respiratory conditions, because COVID is spread, as I think everybody is aware, by droplets. So much of the work that respiratory physios do requires what we describe as aerosol generating procedures: coughing, huffing, suctioning. So we've really tried to work through how we might minimise that, so that that's a reduced risk for both patients and staff. So that's been important for us as well. We've also been making sure that there's less need to go onto the ward areas. So a lot of telehealth, telephones are in hot use. Video conferencing has been very strong as well. Our telehealth focus, both for inpatients and people who are coming to see us as outpatients, has just boomed. So we had a little bit of telehealth happening, say, in February, and that's just huge amount now. So much of our care is via telehealth. So a different way of working, really, and a more flexible way of working as well. So people who live in distant, some distance from the hospital, they really like now the telehealth. So we'll be making sure we retain that down the track. I think the other difference is that people are working in layers of gowns, masks, eyewear, gloves. So putting that on and taking that off safely, the PPE, is a really new and different way of working. So that's been a very important learning for us as well. So we're trying to absolutely ensure that all our staff are well trained in all of that. Really important for our safety. We also have people working in the intensive care unit, where there's a proning technique where patients are managed on their tummies. That seems to facilitate airflow and better airflow into the lungs. So some very new ways of working there. And across the board, lots of interdisciplinary work, lots of streamlining of workflows. So very strong focus there. In terms of rehabilitation, Anton, I think it's interesting as well. We're some months behind the UK, the European and US experiences. So what we're finding is just a gradual emergence of what the post-COVID rehabilitation requirements might be. People who are tired, their exercise tolerance is lower, their perhaps pulmonary, their breathlessness is higher, they're anxious, their cognitive skills are lower. So we're just working through and learning from the UK and Canada and Europe and US about how we might manage people in this post-COVID rehabilitation phase. A small group, but what can we do there to support? So that's going to be an important part, I think, as well. And we're providing this care within the framework of what can we do remotely, how do we keep our physical distance? 1.5 metres is a magic number there. How do we limit the time that we're seeing people, and that constant hand washing, hand sanitising approach? So a really strong focus on safety for our healthcare workers, for our patients and their families, a different way of working in terms of supporting students as well, and looking at professional development. So it's completely different to what we were doing, 6 months ago, that's for sure.
Yeah.
So interesting times ahead, I think, Anton.
Yeah. Fiona, we're just so grateful for the time that we could have with you today. All those words of wisdom, we're just so grateful, and I'm sure many will find it very useful, just tapping into some of the advice that you've given us today. And also for those who are entering the physiotherapy profession, I think that this is a really good insight for them as to what's happening in the hospital sector. What role will I play in the future of physiotherapy? And there's been some real gems there. So thank you for your time. We really appreciate it. I also just want to thank everybody today for tuning in and for catching up with us. And we just want to pay our respects to the broader physiotherapy community and the incredible role that physios are doing around the world in the face of this pandemic. And we salute you and we thank you and the broader health community for protecting us and looking after us so well. So thank you for today.
Thank you, Anton, and what a privilege to be around the virtual table on World Physiotherapy Day. Physios are really working so closely together nationally and internationally. We're absolutely all in it together. So thank you very much indeed for this wonderful opportunity today. It's been a great pleasure.